Today we are going to talk about a common problem that involves the lower part of the spine. That part of the spine is called the lumbar canal. Usually the compression of the nerves in that region can be due to disc prolapses or the ligamental thickening around the spinal cord. This is not a dangerous condition. However, it can lead to severe disability due to nerve damage. Once the clinical diagnosis is made, we confirm the disease by doing an MRI scan. Disease doesn't require surgery all the time. However, in selected cases, doing a minimal access surgery and decompressing the nerves will lead to excellent results. Patients will recover either within few days or within few weeks, and then the patient will be going back to their normal life in a very short period. When we are talking about lumbar canal stenosis, we need to understand what are the parts of the spine. We have the cervical spine, then the thoracic spine, lumbar spine in the bottom part, and the sacrum, which is the lowest part of the spine. Usually, the compression of nerves in the lumbar canal take place around the 4th and 5th vertebra, and then the 5th vertebra and the sacrum. In the younger patients, it doesn't happen usually. However, sometimes with the disc prolapse, the nerves can be compressed in the lumbar spine. But in the old age, after 50 years or 60 years, due to the degeneration process, the joints around the spinal cord as well as the ligaments around the spinal cord can get thickened. Usually, this thickening will lead to back pains and sometimes stiffness. Not all the time it can cause nerve compression, but in very few patients, nerves can be compressed. If one nerve is compressed, there will be symptoms related to that nerve. However, when the lumbar canal is stenosis, most of the time, many nerves get compressed within that narrowed segment. As a result of this compression, patient develop various symptoms that we are going to discuss these things in the future. Now, usually the spinal canal, if we consider, it has 3 curvatures. In the lumbar spine, there's a lordosis. This lordosis is the one that protects the lumbar spine from various stresses. In some patients, this lordosis is lost and the spine is straight. And sometimes it can go into forward bending, which is called kyphosis. And in kyphotic patients also, the lumbar canal quickly get narrowed as the age progresses. Therefore, it's very important to understand this anatomy and keep the correct posture in order to prevent such problems that can occur in the later part of the spine. This is the basic structure in the spine that we need to understand before discussing about the problems in the lumbar spine.